Just on recruitment, I heard what you said earlier in terms of for the fourth year recruitment of GPs is increasing.
Into GP training.
Into GP training, so it's increasing, which is great. In Plymouth and areas like that are more deprived, I often get told that actually the recruitment of them is particularly difficult, it's particularly acute. Why is that? And what are we specifically doing around deprived areas in the UK to make sure that they're still attractive for GPs to go and work there?
Yes, I think you say it accurately and well. So what we're doing is we are identifying parts of the country where traditionally it's been hard to fill places on the GP training scheme, and frankly we are, amongst other things, paying a bonus for trainees who will choose to go work there. So we are paying bonuses that already have benefited 124 parts of the country that have previously not had GP trainees in recent memory. We think we'll get that up to 200 fairly shortly, next year in fact. So some of it's about the attractiveness of GP training. Some of it is about recognising that general practice itself needs to adapt and evolve. And there are enormous strengths in British general practice around continuity of care and list-based general practice, but there are some downsides, particularly around individual practices sometimes struggling in isolation from their neighbours, and so much more kind of networked approaches to working with other practices so that collectively they're looking after 30 to 50,000 people. Then you can put in place the mental health therapists alongside the GPs, you can put in place the clinical pharmacists that we're directly funding, the practice nurses and so on.
And for you, that is very much the sort of forward view of GP care, is these bigger practices where you can get more specialised help.
Or at least smaller practices network together.
So we've had 4 surgeries shut, provider handed back the contract, we've got 3 seeking another provider, 3 who need a new provider by March next year. And what constituents sort of saying to me, and I'm sure colleagues across the country, is that the impression that gives is a GP system in crisis, essentially, that no one wants to be part of. But you think it's very much in flux and moving from one model of care to another, do you?
I do, but I also, I think, was probably the first person doing my job to kind of say sort of outright 18 months ago that I didn't feel that GPs were crying wolf. I actually thought they had a point, and that you see in the CQC report today, actually the number of whole-time equivalent GPs per 1,000 population had been going down. We're about sort of flat to slightly negative in whole-time equivalent GP numbers at the moment, and that's why it's so important that as well as expanding intake and dealing with indemnity questions and changing the design of services, we also need to do some tactical things, and one of those is that I announced in August that we were going to go all guns blazing on a GP international recruitment programme for the next 3 years, aiming to recruit up to 2,000 additional GPs from either the rest of the European Union or places like Australia. And we will be matching them with parts of the country that have particularly struggled to fill vacant GP training places.
Okay, and just